to kind of look at what would I have in my house for what I consider a natural medicine cabinet. And what would I have in my house to use for simple remedies or as adjuncts to a natural wellness program. And of course, a natural wellness program starts with the fundamentals of a good exercise program and a really good nutritional program. That's always going to be the case. Those are two core issues of an effective wellness program. Daily exercise done appropriately within the context of our current health and done in a way that we're not setting ourselves up to get injured. Of course, Kristen in the Achieve program is excellent at addressing just that. So that's why it's an integral portion of our overall wellness services and our lifestyle medicine clinic. As far as a book that relates to nutritional intervention, something that you can use as an individual, as a mother, as a wife, as a family member, I think that Dr. Joel Fuhrman's book, Eat for Health. This is actually a series. This is book 2 of the series where it kind of the practical aspects of implementing a nutritional excellence program. That's what this was written for by Dr. Joel Fuhrman, who's a family physician, but essentially retrained himself in nutritional medicine and is applying that in the family medicine setting. Actually, he's a friend of mine. I sit with him on the American College of Lifestyle Medicine board. We're both board of directors in that. And I believe that his book, actually this is his second book. In 2004, he came out with a book entitled Eat to Live. Exceptionally well-written book. And up until this point, that was, in my opinion, the best book. Somebody asked me, so many books at the bookstore on health and nutrition. What do you recommend? I would recommend his book, Eat to Live. Now I recommend this book, Eat for Health, which the first book kind of gives you the background and the science and the rationale behind the eating plan. And then this is kind of the application book 2, recipes, menus, and so forth. So if you're looking for a tool like that, this is what I recommend. Now, I said that specifically as a lead into the discussion with regards to supplements, because supplements are by design in addition to. Supplements are not substitutes. Let there be no question about that. Some people say, well, I just take my supplements because when I do that, I know that all my nutritional needs are covered. And that's absolutely false. You cannot supplement your way to health. It has to start with the core of a whole foods program and all the other aspects of what we call the natural remedies. The sunlight, the fresh air, the water intake, all those things that we could talk each about for an hour or more are critical, fundamental, foundational principles of wellness. So, but where is the place for, wow, these different supplements? What possible benefit could I get from all these things? Now, I actually chose the ones that I find to be the most helpful for the typical patient. Okay? And so I'm going to discuss many of these in the context of what they would be useful for and what individuals would potentially benefit from these.